welcome to my YouTube channel. On today's video, we'll be talking about diarrhea disease. Diarrhea disease is a frequent of watery and unformed stew. The route of transmission, you can get it by contaminated food, contaminated water, direct contact with infected feces. Let's talk about behaviors that can increase the risk of diarrhea. Using infant feeding bottle, whereby you add the baby's milk in an unclean feeding bottle, it can bring diarrhea. Then failing to breastfeed exclusively for the first 6 months. Then storing the food at a room temperature if cooked food is kept for several hours. Okay, drinking water may be contaminated with fecal bacteria at its source or during storage in the house. Another one, failing to wash your hands after defecating and before defecating and before handling food or before eating any food. Okay, failing to dispose feces hygienically. You fail to wash your hand, you have to wash your hand before and after eating. Okay, so we'll be talking other causes of diarrhea. We have antibiotics. Allergy to a certain body may account diarrhea. Okay, you have diet high of roughages. When you eat much roughages and spicy food, you can get diarrhea. Let's talk about signs and symptoms of diarrhea. We have loss of frequent water stool with a very bad odor. So stool may be or may be not contained with blood. So there is vomiting after diarrhea. Then increase in the bowel sound, dehydration, loss of skin touch, pale eye, depression frontal, dry tongue, and you lose weight. Okay? How you can manage diarrhea at home? You give more fluid like salt, sugar solution, SSS, to continue giving the diarrhea until it stops. You give it to the patient every day until it stops. Give child plenty of food to prevent malnutrition. Then if the child is still breastfeeding, you give breast milk regularly. You make sure you give the baby breast milk regularly. Then give fresh fruits or mashed banana. Okay, give freshly prepared food. You have to give freshly prepared food. Then in children, encourage the child to eat for at least 6 times a day. Encourage the child to eat at least 6 times a day. So you give some food for diarrhea and stuff, and give extra meals each day for diarrhea for 2 weeks. Extra meal for 2 weeks. This will be the end of diarrhea section of video. Thank you for watching and continue subscribing. Bye bye.